which is an informal settlement, and we were shocked to see the amount of rubbish that is normally accumulated during outbreaks, and we believe these are some of the reasons why we have outbreaks of dengue and other waterborne diseases. So we normally talk to the communities and try to assist them in the best possible ways to keep their surroundings clean. And of course, our communication plans are such that we target those areas where our teams go out and carry out health checks and give advice on things that the communities and individuals can do to ensure that we are able to have a control on any communicable diseases, blocked drains, cleaning up of the homes and environments. And we found out that these areas which are struck by floods and heavy rainfall are mostly breeding grounds for a lot of diseases, typhoid, diarrhea, and dengue. So we have outreach teams who are on the ground. They have visited more than 500, not only 500 communities, but they also go around shops for food surveillance, because we believe that a lot of CDs are also arise during post-disaster because of the consumption of food. A lot of people try to salvage the food, and we try to tell people it's better these foods are disposed of, because they will lead to diseases such as diarrhea and typhoid as well. Thank you, Madam Speaker.
Thank you. Honourable Mikael.
Thank you, Madam Speaker. Again.
Sorry, I called Honourable Mikael. I will call you out.
Oh, I'm sorry.
He stood up first.
Thank you, Madam Speaker. I'd just like to ask the Honourable Minister as to the workers, are they also immunized when they go out for these health checks in order to prevent them from these outbreaks of diseases? I mean, the team, when they go out, are they also immunized to avoid any diseases that come from the outbreak of whatever after the cyclone? Thank you.
Honourable Minister.
Madam Speaker, I don't understand what the Honourable Member means. What immunization are we talking about? If you can be clear, I should be able to answer that.
Would you like to repeat your question?
Yeah, Madam Speaker, the question is, are these workers, your team, are they immunized as well in terms of when they carry out their duties in areas where, as you mentioned, regarding the after cyclone? Thank you.
Thank you, Honourable Minister.
Thank you, Madam Speaker. And Honourable Member, immunization of health workers, is that what you're talking about? I think the health teams are better prepared to deal with the situation as and when it arises. And immunization is basically carried out during outbreaks of typhoids. And you don't have immunization during dengue, etc. So typhoid is basically one outbreak where we need the people who are affected to be immunized. And like I said, most of these communicable diseases, Madam Speaker, are preventable. It's just good hygiene and best hand washing practices. So that's what they try to promote. And I'm sure my teams are fully geared to prevent themselves from catching these diseases. Thank you.
Thank you, Madam Speaker. We're talking about responses here to disasters, and the question is whether the budget is always there to assure people that it's all in good hands. I mean, we can be very glib about our replies to questions like that about money, but the fact of the matter is that people are concerned about the cost of MNC. There's consternation in the community right now. So do you have the budget? Can you be assured that whenever we have a disaster, government has the money to mitigate it or to meet it? Thank you.
Thank you, Madam Speaker. I think the Honourable Minister of Economy has already answered that. And if I can restate, yes, as a government, as a ministry, we are ready with the financial budgetary allocations to deal with any outbreaks and disasters. Thank you.
Honourable Premsi.
Thank you, Madam Speaker. A supplementary question. I thank the Minister for response. The original question is, what is the timely, comprehensive and effective responses? And I'm glad that the Minister noted that she mentioned Nawajikuma settlement in Nawaka, in the back road of Nandi. These are part of the response. As part of the responses, Madam Speaker, Nandi Rural Local Authority is tasked with looking after that area in terms of health, prevention and so on. I have 1 minute. Madam Speaker, the responses that we talk about, this is after disaster. Now, the Minister mentioned that the drains, blocked drains, waterways that are around the place. So, Nadi Rural Local Authority should have, in a proactive measure, They could have addressed that. And we still see after the disaster that it is still there. So, you're part of your response. What is the ministry doing to engaging itself to be more proactive?
Order.
Sorry.
Please.
Thank you, Madam Speaker. Madam Speaker, the reason why I mentioned Nawaka Tremline settlement, it's not only one of the settlements that the team has visited. Actually, we visited a lot of settlements. And when we visit these informal settlements, we find out there's a real issue of garbage disposal. I mean, these are settlements where people have actually bought the land or leased the land from landowners. I'm not sure. I stand to be corrected there. But they have connections to water supply. They have connections to electricity. But when these settlements are established, there's very little importance given to garbage disposal. And I've spoken to the people, and they have come up with a solution. They're going to work with the NENDI or any other rural authority where they've said they will be responsible for disposal of the garbage. But where do they dispose? That's a question, Madam Speaker. So we are going around the country meeting these informal settlements and trying to advise them how best it can work. As NENDI rural authority or any rural authority, we cannot charge money for garbage disposal there. By law, we cannot charge informal settlements to pay for the garbage disposal. So the solution lies within the people, and we are working with the people as to how best they could collect their own levy and work with the local service providers so that garbage could be disposed. So, I mean, that's a solution based. I say, I don't believe in this blame game. Who's supposed to do that? So I even spoke to the people. If there's a drain and people plant cassava and dalo there, I mean, the simple thing. So community ownership of their problem is something that we are trying to promote, trying to create more awareness, and how best that communities can come up with a solution. Of course, I understand we talk about local rural authorities. We don't have that power to do those things because those are informal settlements. So yes, we are trying to find solutions to that, and communities are coming up very strongly and very receptive to the fact that they will be responsible for the disposal of the litter.
Thank you.
Thank you.
Honourable members, please be reminded you have only 1 minute to ask a question. It is with great reluctance that I have to cut you short within that 1 minute. And I give the floor to the Honourable Asiri Randondro.
Thank you, Madam Speaker. I'd like to ask the supplementary question to the Honourable Minister
Supplementary question.
on her explanations about the comprehensive health measures that has been announced. Just wanted to ask the Honourable Minister if these comprehensive health measures are genuinely effective. Are they genuinely effective, given there is always a delay in the announcements of the various outbreaks like meningococcal dengue that now seems to be on the rise on frequent occasions?
Thank you, Honourable Minister.
Thank you, Madam Speaker. Thank you, Honourable Member, for bringing that meningococcal outbreak in. Madam Speaker, outbreaks are not just announced overnight. Normally, we have to study the disease pattern. So in 2016, when there was an outbreak, I'll give an example of St. John's College. There was an outbreak of menC. So that was contained by the health team. As soon as it was diagnosed, tests were sent overseas, reports came confirmed, the students were vaccinated, and to date, Madam Speaker, we have had no cases from St. John's College. So outbreaks mostly happen in sporadic areas. So we just cannot declare an outbreak just like, so 2016, there was an outbreak there. 2017, yes, the numbers were increasing, so we declared an outbreak. Now what has happened, Madam Speaker, the fear that has been generated in the public is great. I totally understand people are scared because menC or meningococcal disease is life-threatening. But Madam Speaker, from the beginning, we have been saying it's treated. It can be treated with an antibiotic if detected early. So, unfortunately, I think the media has a role to play, the other side has a role to play in creating that panic within the people. From day one, Madam Speaker, we have been saying, Madam Speaker, from day one, we have been saying our experts, WHO, have been guiding us on this, and based on their advice, we have been telling people, look, it can be treated. Any signs and symptoms, please present, and we have done that. There are a lot of people, but unfortunately because of the fear that it's a life-threatening disease, people have been rushing down to pharmacies. As mentioned in the earlier bit, they've been rushing down to pharmacies. People have been making money out of that. But if I can assure the nation, like Honourable AG said, it's treatable, it's controllable. We have antibiotics that actually cure people. And it's free, yes, it's free. Thank you.
Despite all that, the people are dying. Last month, 21-year-old Inosori died of dengue. And she shouldn't die because of the carelessness of the doctors. They cannot diagnose. Bad attitude. So what internal programs do you have to ensure that doctors know what they're doing.
Thank you very much, Honourable Member, and thank you very much, Madam Speaker. Madam Speaker, it's absurd for somebody to stand up and say somebody died of dengue. You need to look at, Madam Speaker, it's very important, Madam Speaker, to understand the complications of these cases. We've always said, please present yourself early for detection. Early detection saves life. Unfortunately, Madam Speaker, there are cases of leptospirosis, dengue, which reaches that late stage. Unfortunately, people have died because of reaching the hospitals late, and it's not right. I think it's not justified to just push the blame on people. Madam Speaker, nobody from the other side talks about preventing these things. I haven't heard anybody talking about, let's go out and clean our communities. Come on. Madam Speaker, nobody from the other side talks about, let's get communities cleaning up. These are preventable diseases. These are caused by mosquitoes. Because, Madam Speaker, I don't need to answer him. Madam Speaker, it's very important for people to present early so that it can be detected. Yeah, it's really absurd and sad. I'm sure doctors are listening. They work hard trying to save lives. So you need to be really... like I said, it's not a blame game. Mosquitoes breed. People get bitten by mosquitoes. But let's look at why do these mosquitoes breed, Madam Speaker? Because we keep our environment dirty. It's not about public health, Madam. It's about individual attitudes, Madam Speaker. It's about individuals' attitude. It's about attitudes. We really need to be responsible for our health. Not when we reach this hospital at the end stage and start this blame game. It's not about blame game, it's about saving lives. Thank you very much, Madam Speaker.
Thank you. And I give the floor to Honourable Salvatore.
Thank you, Honourable Speaker. Pertinent issue coming out from the Minister's response is preventative. So can the Minister confirm whether all those areas that have been affected by the recent cyclone are now accessible to water, so that you can fulfill the obligation under SDG, accessible to clean water and sanitation? So what preventative measures are in place? Thank you, Madam Speaker.
Honourable Minister.
Thank you, Madam Speaker. Madam Speaker, I did mention any response to any outbreak or disaster, natural disaster, is a coordinated response. Yes, there are agencies working to ensure that communities are supplied with clean and safe drinking water. Those communities we have visited, Madam Speaker, we've been distributing water purification tablets so that the water that they drink is safe for them. Thank you.